So I'd like to introduce to you today Dr. Adrian Lopresti. He's a clinical psychologist in private practice. He's also a senior researcher at Murdoch University in Western Australia. He has over 19 years of experience working with children and adults who are suffering from a wide range of mental health conditions, and some of those include depression and anxiety-related disorder. He's published several articles in peer-reviewed journals. He's looked at diet, nutraceuticals, sleep, exercise, all of their impact on different biological pathways that are associated with depression and ADHD and bipolar disorder. He's completed clinical trials investigating the antidepressant effects of both curcumin and saffron in people with depression. He is a strong advocate of psychological, nutritional, and lifestyle-based interventions to enhance mental health. I have heard Dr. Lopresti speak before, and I think you're in for a real treat tonight. So welcome, Dr. Lopresti.
Welcome. All right. Well, thank you very much for that, Cheryl. Yeah, I mean, obviously today what I wanted to do was talk a bit about the integrated treatment for anxiety and depression, and really just highlight the fact that it's not one treatment that's going to really heal kind of the symptoms associated with depression and anxiety. Usually it's multifaceted, and I just want to really just go through some of the areas that I think are particularly important in terms of improving one's mental health. So hopefully it will give some people some food for thought that they can go away with and actually apply some strategies for themselves, or give advice on how they can best help others. So firstly, what I wanted to do was just go through some of the current treatments that are presently used. And the reality is that the two are primarily psychological and pharmacological treatments. So cognitive behavior therapy is probably the most common type of psychological therapy that's used across the world. And then there's varying antidepressant medications. Unfortunately, I mean, they seem to help about 50 to 80% of people in terms of getting 50 to 80% get 50% better. Now that means that another 50% don't realise those effects, and in actual fact, probably about 20 to 30% get no benefit at all. So only about 30 to 40% fully recover. So there's at least 70% of people, or 60 to 70% of people who actually don't experience full symptom remission as a result of psychological or pharmacological treatments. So when you look at the combined treatments, because that's the other option, is to do psychological therapy and antidepressant medication, the improvements are slightly better, but again, there's still a lot of people who don't obtain full benefit from treatment. There's an interesting study known as the STAR-D study, and basically one of the criticisms with researchers, they go, well, you've only given one medication, so in reality, we would trial different medications and then eventually find one that works. So they wanted to look at how effective that was. So what they found was that, so in this treatment, patients received up to 3 antidepressant trials if they were unresponsive, so something that you would probably experience in real-life treatment. And again, what they found was that only 30% fully recovered after 3 months, which is still a concern. There's a whole range of newer antidepressants, I suppose, on the market. They're known as selective serotonin reuptake inhibitors and so forth. Unfortunately, as the newer treatments come out, what we're finding is that there may or may not be less side effects associated with it, but they're no more effective, and that's a concern. So despite all this research being dedicated to antidepressant medications and other medications, we're actually not finding any treatment that works better than any other. Again, there's also different types of psychological therapies that are available, and they're all pretty equivalent in how effective they are. So there's quite new forms of cognitive behavior therapy, and there was initial excitement about that. But and while they can be useful for many people, again, the research shows that they're not that effective on their own. So what led me into, well, one of the things that led me into kind of the integrative approach was obviously this lack of positive research in the area of single treatments. But I saw this study some years ago, and I just want to highlight what an integrative approach can do. So in this study, they actually had people with depression, non-seasonal depression, just your standard depression, who are on antidepressant treatments. And what they did was the first group received obviously antidepressants, plus they received the following information. They were recommended to go to bed when sleepy and not before 11 o'clock at night. Use your bed and bedroom only for sleep and sex. If you do not fall asleep after 15 or 20 minutes, get up and start an activity until you feel sleepy enough to go back to bed. Get up early, never later than 9 a.m., no matter how well you've slept. So this first recommendation is about sleep and some basic sleep hygiene. The second recommendation was around exercise, so walk at least an hour a day at a good pace, so without becoming short of breath. So second one, around exercise. So a little bit more information about that. So we've got sleep, exercise, sunlight. So be exposed to sunlight at least 2 hours a day, taking precautions to avoid sunburn or sunstroke. So now we've got sunlight, vitamin D, and actually being out in nature. And then the third one was to try and eat a healthy diet. And eat regular hours, not snacking, avoid sweets or sugary drinks, and eat fish, plus fruit, cereals and nuts. So this first treatment then received recommendations on diet, sleep, exercise and sunlight exposure. The control group, they were just provided with these 4 recommendations. Sleep the hours that you feel your body needs, adapt to the pace of daily physical activity, if exposed to sunlight, take precautions, and try to eat a healthy, balanced diet. So this was the only 2 differences between the 2 groups. One received more comprehensive information about an integrative approach, and the other received very minimal information. And so what do they find? Well, the response number is the number of people who experienced a 50% reduction in their mood. How many responded? 3 in the control group versus 13 in the active treatment group. Huge difference between the 2 just in terms of this integrative approach where we provide multiple recommendations. Remission, this is the number of people that experienced or had a full symptom remission, who had a full recovery from their depression, and 1 from the control group and 11 from the active treatment group. So again, this integrative approach, very simple, it's very simple recommendations that were provided, resulted in greater improvements in the effectiveness of the treatment that was offered. Now, this study has been replicated, and the second results weren't so positive, and what that indicates to me is that it needs to be more than just written recommendations, because that's basically all that was offered here. But this first study does indicate to us that if you look at different areas of modality to treat somebody's mood, then you're going to have a greater effect. So I use and kind of work on a treatment known as, which I call the personalised integrated therapy. And basically there's 5 foundations to this. Psychological treatment, I think, is an important part of somebody's recovery. So I'm certainly not denying that. There's also lifestyle environmental changes that we need to consider. Diet and nutrition is extremely important for one's mental health. Social and spiritual, which I'll go through all of these in greater detail. And there's also the biological and medical, because there's certainly biological and medical factors that can impact on someone's mental health, on their depression, anxiety, or any other mental health condition. Now, the key here is really about individualising or personalising it. What works for one person may not work for another. You might have one person whose social network, social connections is really good. They have really good support networks. So you don't need to target that one because that's already working, that's already going fine. Then you've got someone else whose social networks is limited, and therefore you need to really target that in treatment. And if you're listening to this webinar for yourself, I want you to think about how each of these areas apply to you and which areas that you may need to change. And the key here is that it's not one solution that's going to result in improvement. It's 10 small changes which on their own aren't going to do much, but collectively they're the most powerful treatments we have available for the treatment of anxiety and depression. So the psychological is foundation 1. So obviously our thoughts and our beliefs can affect how we feel. If we've got negative thoughts about and negative belief systems about ourselves, our environment, and our future, then our mood's going to be affected. So the psychological treatments maybe work towards modifying those areas, which is cognitive behaviour therapy is one way to do that. reducing worry about the future. Now, I'm not saying just reduce your worry about your future just because I tell you you're going to stop, but the key here is about learning strategies to reduce worry, and which psychological therapy can target. There's also rumination about the past. People who often worry about the future, they're often more kind of anxiety, and those who ruminate on the past, who are obsessed about the past, is more the depressive symptoms. So again, learning strategies to decrease rumination, which the psychological therapies can target. If there's any past trauma or loss that keeps kind of appearing in somebody's kind of thought patterns and daily kind of activities, then that needs to be targeted through psychological therapies. And learning appropriate coping skills and emotional regulation skills, learning how to regulate your emotions, learning how to self-soothe is extremely important. And this is something that psychological therapies are very good at. And obviously there's a whole range of relaxation strategies that people can learn, such as meditation, your controlled breathing and things like that, which again are a target of psychological therapies. So these are all extremely important. So there are several options for psychological treatments. I'm just going to list some of them, some of the more popular ones, but there are more. These isn't a comprehensive list. So there's cognitive behaviour therapy. Obviously, I'm using the Australian behaviour spelling there. There's something called acceptance and commitment therapy, which is becoming a very popular treatment at the moment, and that can be effective. Interpersonal therapy is another type of therapy. Behaviour activation therapy, which in actual fact is actually quite a simple therapy, which is basically, I see it as going to do more stuff. If you do more, you'll feel better. If you feel better, you'll do more, and it leads a cycle upwards. For trauma in particular, there's something called eye movement desensitization and reprocessing, EMDR, which can be extremely effective for the treatment of trauma. And then obviously there's all your relaxation therapies, controlled breathing, progressive muscle relaxation, autogenic exercises, and so forth. And finally, I think it's really important, learning meditation, learning mindfulness, learning to be present, learning to experience the present moment and savor the present moment, so rather than being in our head all the time. And these are all skills that can be taught in therapy. Now, as I said, this is an extremely important component of a comprehensive treatment, but it's not the only solution. And this is where our lifestyle environment really is important too. So we need to reduce or manage life stresses. I'm not saying eliminate our life stresses. It's about looking at how can I reduce stress in my life? What am I doing? What decisions do I need to make? What changes do I need to make to reduce my life stresses? And whether that be work, social stresses, academic or stresses, or any other factors that might be impacting there. If you want to improve your mood, you have to improve your sleep. I mean, that's crucial. And there are several strategies that you can use to improve your sleep quality. That doesn't mean that everybody's going to get 8 to 10 hours of peaceful sleep. But even there, if you can improve your sleep by 10–20%, and then you improve all the other areas by 10–20%, you have a treatment that's extremely powerful and the most powerful treatment there is available. So do not neglect sleep. If you want to suffer from depression, spend the next few weeks not sleeping, and I'll tell you, you're more likely to suffer from depression or anxiety, that's for sure. Engage in regular exercise. Exercise is an extremely effective natural antidepressant. This doesn't mean that everybody needs to go away and join a gym or go to a boot camp or something like that, which is where they're basically going to kill themselves engaging in a high-intensity exercise. But it really looks at choosing a form of exercise that's appropriate for you, that you feel as though you can do, and just working from there. Some of the research has indicated that exercise is as effective as the cognitive behaviour therapy and pharmacological therapy. But remember, they weren't that effective on their own either. So I'm not saying exercise is the solution. It's a component of it, and I'm going to keep repeating that. Be more active, reduce sedentary activity. So I'll include this as a separate one because it's about really sitting down and how much time are you sitting, how much time are you engaging in non-activity, and that's really important because we know that things like watching TV all day is not conducive to good mental health. Optimise your sunlight exposure. So there's certainly research to show that not just vitamin D, but actually being out in the sun is really positive. But obviously you need to ensure that you take precautions there to protect yourself from the sun exposure. Increased exposure to nature. So being out in nature, being out in the environment is also positive for our mood. So are there things that you can do as an individual to improve, to make changes in that area? Engage in pleasurable activities. So what things do you like? What hobbies do you have? Many of the clients that I see actually can't answer this question, which is a real concern. So it's extremely important that people find activities that they find pleasurable or soothing, and that they actually allocate it to part of their daily routine. Reduce technology use. So all the people out there who are consistently on Facebook or social media, it's really important for you to regulate that because too much of it can be very detrimental in our mood, particularly as people generally portray the positive things about themselves on social media, and that gives you kind of the thought that maybe everybody's happy and their life is great and my life is not so great. But you're really only getting a snapshot, a preview. It's like when you watch a movie and you think how great that movie was because you're seeing the best bits, and then you watch the movie and you think, oh, it wasn't as great as the preview. Minimise alcohol, nicotine and other drug intake, which is, again, certainly messes with all our hormones, increases inflammation, creates free radical damage, which then in turn reduces our mood-lifting hormones or neurotransmitters like serotonin and dopamine. And even just minimising exposure to toxins, so whether that be environmental toxins, even air pollution, noise pollution, but also the toxins we use for cleaning and cooking and things like that, and obviously the foods that we eat too. So I just want to pick on nature, I suppose, green space, because this is something that people often don't consider when we look at improving mood. But what the research shows is that greater access to green space, to the environment, is associated with less depression. In one study, they found that pregnant women in the greener environments were 18 to 23% less likely to report depressive symptoms than those in the non-greener environments. One interesting study where they looked at CBT, cognitive behaviour therapy. So one group received, the groups received 4 weeks of cognitive behaviour therapy. One was conducted in a forest environment, in nature, outside. And what they found in this group is that 61% experienced a remission of their symptoms. So 61% experienced full recovery in those who received CBT in a forest environment. However, those who experienced CBT in a hospital setting, only 21% experienced remission of their symptoms. So just by changing the environment, increase the effectiveness of cognitive behaviour therapy. Small change, but a significant one. Technology use. Research shows that the greater time spent using screens for leisure is regularly associated with depression, lower self-esteem and poorer mental health. This is both for adults and youth. Bedtime use of media devices doubles the risk of poor sleep in children. So looking at media, looking at how you can make I'm not saying to ban it, but it's about reducing exposure to it, replacing media devices with other things that might be have more positive effect on mood. One study showed that taking a 1-week break from Facebook had positive effects on life satisfaction and intensity of positive emotions, just 1 week. Toxins. Previous pesticide poisoning is associated with a 2 to 6 times increased odds of depression or other psychiatric disorder. Now, this is pesticide poisoning. I know this is not, we're not necessarily poisoned by where we experience acute exposure to pesticides, but it's that gradual, that constant, minimal pesticide or other poisoning that we often get that can impact on mood. Findings of increased, in one study that showed had findings of increased suicide rates in areas with intensive pesticide use more than doubled the risk of suicide. One study showed that low levels of lead exposure reduced intelligence in school-aged children and increased impulsivity. So this is just a snapshot of some of the studies there that indicates that toxin exposure can impact on mood. Even the exposure to PCBs in blood was higher levels were associated with increased prevalence of depression. So how can you reduce some of your exposure to toxins? What small changes can you make? What things do you need to replace in your home environment that can help reduce some of the toxin exposure? And obviously air and noise pollution is another one, that seems to affect mental health too. Diet, another crucial element to the integrative approach. So we certainly need to improve our diet quality, and I'll go through that in more detail. We need to treat nutritional deficiencies and excesses, and again, I'll go through that in a little bit more detail. Food allergens and intolerances. Exposure to food allergens or foods that we're intolerant to, not ones that would necessarily result in an allergic reaction, but that we're even mildly intolerant to. If you continue to expose yourself to those foods, that then greatly impacts on some of the hormones and neurotransmitters that are important for mood. I'm going to talk about some mood-boosting supplements, natural supplements. Now, they're not the answer. They're supplements. They're to supplement our integrative approach. But as I said, if you include supplements in your integrative plan, then they can be very beneficial. But they aren't the only answer. Nothing is. So in terms of improving diet quality, it seems as though eating a Mediterranean diet is very protective against depression. That doesn't mean other types of diets, your Japanese type diets or your vegetarian diets too. There's some research around that. But basically, most of the research has been conducted on Mediterranean diets, and that indicates that people who eat a more Mediterranean-based diet, fruits, also vegetables, whole grains, legumes, fish, they seem to have a lower prevalence of depression and anxiety. For many of you, you'll be happy to know that even minimal kind of alcohol intake is appropriate too. Fish consumption has been linked to positive mental health. The omega-3s in fish seem to be extremely important for our brain function and for our neurotransmitter function. We do need to be careful nowadays because, unfortunately, the mercury that's contained in fish, so you need to choose carefully and choose wisely. Fruits and vegetables are extremely important. More so the vegetables in particular, they contain obviously phytonutrients, which helps our body reduce inflammation and reduce free radical damage, which is important for brain function. They also contain a lot of vitamins and minerals, which are really important for our hormones. I'm a big fan of herbs and spices. In particular, I've done a lot of research looking at the effects of curcumin from turmeric as an antidepressant, and the results are extremely positive. So certainly consuming herbs and spices, including that in your diet as much as possible. I often even just recommend to clients, how can you include this in your diet? Even add a few parsley flakes to a roll or something like that, which is insignificant, but ultimately over time it can have a significant effect. We need to make sure we eat good quality protein, which I'll go through in a second why. Nuts and seeds are extremely important. They have good fats and important minerals, which are important. So how can you, as an individual, look at just improving some of this? It's not about making your diet perfect. It's about making your diet better. So if you can, again, improve diet by 10, 20%, plus you include small changes in all those other areas, then your mental health will be positively improved. And we need to avoid junk food, unfortunately. Unfortunately for many people, because that's often the staple of their daily diet. But takeaway foods and processed foods are very inflammatory. They're nutrient sparse. They don't have nutrients in there. And in actual fact, they're so devoid of nutrients food companies need to add the nutrients back to at least give them something. And we need to drink water, preferably filtered water, but not soda drinks or diet, and that includes diet drinks. Diet drinks are extremely toxic with the additives and the aspartame and so forth that they and the artificial sweeteners that they put in there. So how do we optimize the nutrition? Well, the nutrients that are extremely important for mental health are the B vitamins, are extremely important, particularly B6, B3, and folate is another one that's extremely important for mood. So we need to make sure that our B vitamins are high, our folate's high, and this means really ensuring that your diet contains lots of vegetables and in particular. Zinc seems to be a very important nutrient for mental health, so ensuring that we have enough zinc in our diets, because that seems to be really important for neurotransmitter production. Magnesium, a really nice calming mineral that's it's really important for mood, and unfortunately many people are deficient in magnesium. So I won't go through the different foods. So if you're interested in looking at the sources of these different nutrients, then just check on the web, foods high in magnesium, and then and try to look at supplementing or including those in your diet. You may look at supplementing, which I'll go through later too. Omega-3 fatty acids, so your fish consumption is extremely important. For people who are vegan or vegetarian, then you can derive some of these from your nuts and seeds, but unfortunately, I think that fish is certainly the best source. And vitamin D, unfortunately, given in Australia in particular, we have. I'm not sure how it is in the US, and in other countries, but certainly there's a lot of talk about protecting yourself from the sun and skin cancer and things like that, which is extremely important. But as a result of that, many people are now deficient in vitamin D, and vitamin D is a really important nutrient that we derive from the sun that's important for hormone production and neurotransmitter production. Iron, really important, and I find that it's mums who are particularly low in iron, and a lot of children can be low in iron, which unfortunately doesn't get tested a lot, but I think if you're suffering from mental health, then you do need to just check your iron status, ensure that those levels are fine. And copper, having too much copper can also be an issue for many people too, so that's really important to consider too. And finally, your amino acids. Your amino acids derive from protein, and I mean there's a whole bunch of other nutrients that are important too, but these are just a selection of the ones that I think we need to consider. So serotonin, for many of you, if you don't know, is one of the neurotransmitters that's associated with depression and anxiety. So it's kind of believed that lower levels of serotonin are a cause of depression and anxiety. Now, it's not as simple as that. It's not just a serotonin deficiency that's the cause of depression. There's a whole bunch of other things that are going on. And even the question for me is, if someone is low in serotonin, why are they low in serotonin? Because what we generally, the standard treatment at the moment is, okay, let's increase serotonin by giving you an antidepressant that increases the availability of serotonin. But that doesn't treat the reason why serotonin might be low. And I just want to go through this slide that just highlights how serotonin is made. And this isn't my theory, this is basic physiology. So we eat protein, fish, eggs, chicken, beef, nuts, seeds, so forth. Our then body, when everything's working fine, our body then breaks it down. Our stomach breaks it down. Our acid and our digestive enzymes break down the protein into one amino acid called tryptophan. Then the body, there's an enzyme called tryptophan hydroxylase, which basically then converts this tryptophan into 5-HTP. And then there's another enzyme in our body called amino acid decarboxylase, well, the carboxyl. And or it's decarboxylates, but, and that converts it into serotonin. So the step is protein, break it down, tryptophan, 5-HTP, and serotonin. So you've got your antidepressants, which target the last step, which is let's increase serotonin by taking an antidepressant. I mean, you've also got your natural supplements too, which, you know, you might be taking tryptophan and your 5-HTP to increase serotonin, but it still doesn't treat the cause. Why are you low on serotonin in the first place? Why are you low on 5-HTP? It's not treating the cause. So what are the causes? Well, if you don't eat enough protein, you're not going to produce serotonin. So are you eating enough protein in your diet? If your digestion is poor and you're not breaking the protein into the amino acids, and if you're on medications that impact on that, then you're not going to turn it into tryptophan. If you're low in essential cofactors, so those enzymes, the enzymes that I'm talking about here, they need things like B6, zinc, folate, magnesium, plus many others to work. So if you're low in those enzymes aren't working properly, so you're not engaging in the conversion. So those are the things you need to consider to increase serotonin. And then all these other things that I've just, in this next box, reduces serotonin: high stress, inflammation, poor sleep, oxidative stress, which is free radical damage, certain medications, alcohol and other drugs, poor digestive health, excess toxin exposure, all the stuff I've talked about, that breaks down serotonin. So if you want to increase serotonin naturally, you need to look at all these different areas, not just take an antidepressant, not just take 5-HTP or tryptophan, but look at what potentially might be going on for you and then increase serotonin that way. The other area that's important is food allergies and intolerances. So certain, I'll just go through some of the more common ones: corn, peanuts, tree nuts, fish and shellfish people can be intolerant to. Gluten receives a lot of publicity as it can cause intolerances. Milk and dairy, eggs, soy, nightshades, strawberries, citrus fruits. All these are the most common intolerances, and this can impact on mental health. So have a think about whether any of these might be impacting on your mental health. And if you think maybe that might be the case, then look at an elimination of those foods for a period of time and see what impact that has on your mood. And obviously the other one, which everybody should avoid, is MSG. So the next step is the supplement side of things. So we've got improved diets, we've got all the lifestyle changes, we've got psychological therapy, and then we've also got your supplements. And so what do I recommend as a kind of your core supplements? I mean, firstly, I think that most people should consider a B complex. Obviously, we get our B vitamins through our diets, but maybe supplementing with a good quality B complex that includes all the B vitamins might be important. And I'd say, choose a reputable brand. Fish oil, or omega-3 in particular, it's not so much the fish oil, it's omega-3 in particular that seems to have an important effect on mood. So for children here, I've got the dosages and for children and adults. A lot of the research indicates that those fish oils with higher EPA levels compared to DHA levels are the most important, so choosing your high EPA forms. There is now research actually indicating, which I've recently become aware of newer forms of omega-3s, non-oil omega-3s, which have delivery systems that means that it basically it's absorbed better into the body, and so therefore you don't need as much. And these different forms, these newer forms, also the benefit is that they don't go rancid, which is a big problem. So certainly they're considering some of the newer forms of omega-3 is something that may be worth considering for a lot of people. The other one I've just recently added to my core supplements is probiotics. Now, I don't think probiotics is the answer to improving people's mental health, but it's part of that solution. And you might be thinking, how does probiotics kind of impact on mood? But our gut is extremely important. Has an extremely important, great effect on our brain function. So, and all our bacteria in our gut produces many vitamins and assists with hormone production and so forth. And And so taking a probiotic with multiple strains might be a good core supplement. So B-complex, omega-3 oils, whether it be from fish oil, the new delivery forms, or a probiotic as your core supplements. To obviously treat deficiencies, if you're low in any of these, you need to make sure that you probably need to obviously eat it more through your diet, but also supplement with these with either vitamin D, B12, zinc, iron, folate, or magnesium, or any other nutrient deficiency that you may uncover. So some of the supplements that I think are the most effective, or the research has indicated as most effective for depression in particular, is the most popular, most commonly known is St. John's wort. I've kind of reducing my use of this because the problem with St. John's wort is that it interacts with many medications. But certainly the research indicates that St. John's wort, nice, effective, natural antidepressants available. The other one's SAMI, which also has nice research as a form of antidepressants. The problem is that it is quite expensive, and the dosages you need, I find, are quite high, so I don't use it a lot. This is one of my areas of research, as I said earlier, was looking at the area of curcumin for the treatment as an antidepressant, and basically there's been several studies now to show that curcumin is an effective antidepressant. And I'll go through how that possibly works, but that's something to consider. I do recommend that people, if you do use curcumin, you use a high bioavailable form, because curcumin is poorly absorbed in the diet, in the body. So you need to choose a form of delivery that's a form of curcumin that has a higher bioavailability, that's absorbed better in the body. Some people would add black pepper extract and things like that, but that's probably more, there's now new forms of curcumin that are even more bioavailable than that. Certainly adding turmeric to your diet is extremely important, but you do need to supplement with curcumin because there's only about 2 to 4% of turmeric contains curcumin. So you'll need to eat a lot of turmeric, lots of a few tablespoons of turmeric, and you'll get gut problems. So I'd certainly recommend the curcumin there. And the other one that I do a lot of research in, and I'm actually conducting a study at the moment looking at the effects of saffron for teenage depression and anxiety. So I'm actually in the process, I'm halfway through that study at the moment, looking at the effects of saffron there. But saffron is also a nice antidepressant that's been studied in more than 10 studies, double-blind, placebo-controlled studies, showing that saffron is an effective antidepressant. So how do those two work in particular? How does curcumin and saffron treat depression? Well, what we know with depression is that many people with depression have chronic low-grade inflammation. They don't necessarily feel it, but if we looked at their blood, we'd see just some low-grade inflammation going on. They also have, many people with depression also have free radical damage, too much oxidative stress going on. So that's also happening. And see, curcumin and saffron are nice anti-inflammatories. They're potent antioxidants. People with depression also have an impaired stress response, and it seems as though both saffron and curcumin seem to modulate that stress response. And obviously the neurotransmitter imbalances, serotonin and dopamine, can be a problem, which it seems again that curcumin and saffron may have benefits from there, whether it's by decreasing inflammation, and then if you decrease inflammation, increase serotonin levels, I'm not sure, but certainly that has an effect from that perspective. And these herbs and spices, I suppose, are also really important for neuroprotection. They're very protective on the brain, and they probably work from those mechanisms. Stress and anxiety. So if you're suffering from stress and anxiety, the nutrients that I recommend are magnesium, a good form of magnesium. Avoid your magnesium oxides, they're poorly absorbed, but there's good forms of magnesium there. Theanine is derived from green tea, an amino acid in green tea, and that has some really nice calming effects on stress and anxiety. Rhodiola is another one that I like, and there's some good research there to show that rhodiola has some positive benefits in reducing stress and anxiety, and particularly is really good for people with suffering from burnouts. You know, people who have experienced chronic stress can eventually feel burnout. Many people use the term adrenal fatigue to describe these individuals, and rhodiola is a very effective herb from that perspective. Kava is another one that's a lot of research has indicated is a nice calming and anti-anxiety option. Passion flower is another option for people, and ashwagandha is another nice one there that's available. That's again can reduce stress and probably works similar to rhodiola from that perspective. So you can take these either on their own or in combination formulas. For sleep, magnesium again pops up. So you know, it's almost like I probably would include magnesium almost as a core supplement. Melatonin might be an option for many people. It's a bit hit and miss, but for people, so you might be worth a try to see whether taking melatonin might be helpful. For others, it may not work so well. I like actually glycine. There's some nice research to show that glycine is an amino acid that seems to have a positive effect on sleep. So possibly glycine. Lavender is another one that's quite very calming and probably has some nice positive effects on sleep if you're suffering from sleep problems. Now, the other one's valerian and lemon balm, and there's others available too out there that improve sleep. Now, however, the most effective treatment for insomnia is good sleep hygiene. So you've got to make sure that your bedtime routine, your bed environment, and how you care for yourself during the day, they all impact greatly on our likelihood of sleep. So it's not just taking a supplement that's got to fix this. You do need to consider your sleep hygiene. And if you want to look at what sleep hygiene is, again, just type that word in on the internet and you'll see some tips for better sleep hygiene for you. Foundation 4 is the social and spiritual components. It's really important for us to increase our social group and support networks. You know, we are human beings who really desire connection and intimacy with people, whether that be emotional or physical. So it's really important to dedicate some time to improving your social group and developing a social group if this is an area that's lacking. Many of us may have people around us who are toxic, I suppose, who cause significant strain or stress on us. So how can you minimise your exposure to such individuals? Yes, you may not be able to avoid them completely, but how do you minimise being around them, and what strategies can you use to help you manage such individuals? If you're married or in a relationship, then you know we do know that a good, solid marriage or relationship is extremely important for good mental health. So you work on it, make it a priority. If there is causing you strain, then you know seek counselling. You know, make it a priority. Having a sense of community, being part of a community, again, is another area that's extremely important for mental health. So how are you? Do you feel part of your community? Do you feel like you're isolated from it? This is where more your non-Western countries are better than we are at this, is that sense of community and that occurs. We've become more and more isolated, which I think is a significant problem for us. And live a valued, meaningful life. Now, I know a lot of people will go, well, I don't know what that is. But that's a question that you need to ask yourself. What kind of life? If you look back at your life, you're 80 years old, you looked back in your life and you said, I lived a great life, what would that look like? What is important to you? What areas in terms of family, in terms of community, in terms of your own spirituality, you know, is religion important for you? Those types of things, and then live a life that's conducive to that. And finally, number 5 is our biological and medical. Now, we need to treat medical illnesses, and that's not necessarily through drugs, but certainly all the things I've actually all talked about is really important for improving our physical health too. So one of the side effects of doing this integrative approach is that you might be physically better. Shock, horror. So I think that's something that you need to be very, very mindful of, is how do you improve your physical health. In terms of your medications, I think it's really important for you to review your medications. I'm certainly not going to tell you to go off any of your medications, but review them. Only include essential medications. Consider how some of your medications might be impacting on your mood, which I'll go through in a second. So if you are on psychiatric medications, whether they be antidepressants or anti-anxiety, how do you optimize them? And that basically means how do you use the necessary amounts but not too much? Ultimately, if your goal is to get off them, basically you need to increase all those, or create all those changes that I've already talked about. But do not go off your psychiatric medications without consultation with your doctor first. Identify and manage with your doctor any medications that might be affecting your mental health, which I'll go through. Manage nutrient-depleting medications, because there's many medications can reduce some of the nutrients important for mental health. Optimize your gut health. Balance your hormones, whether they be sex hormones or thyroid hormones, and balance your blood sugar levels, and achieve a healthy weight. Now, that doesn't mean that everybody needs to be in the healthy weight range, the BMI of 20 to 25, but it's about going, okay, again, if you lost 10% of your weight, plus improve 10% of all the other areas, then that will have a really positive effect on your mood. The gut-brain connection, this is a really popular and very exciting area of research, and we're beginning to understand that not only it was thought that the brain affects the gut, but now we know that the gut affects the brain. So we really need to consider that. Many people with depression, and with even schizophrenia and bipolar, have what we call leaky gut or intestinal hyperpermeability. And this leaky gut can cause inflammation, can affect our ability to absorb nutrients and so forth. So looking at kind of healing that leaky gut is extremely important. Our gut flora, this is where the probiotics that I talked about is extremely important, and ensuring that our gut flora is optimized and avoiding medications, particularly the excessive use of antibiotics. Ensuring that your digestive enzymes and stomach acid is important. There's many medications, obviously, your proton pump inhibitors and things like that. Your antacids designed to kind of improve the symptoms associated with heartburn, but they also reduce stomach acid, which stomach acid, there is a purpose for it. It helps us break down food, so we don't want to eliminate it. What are the risk factors? If you suffer from any of these potential risk factors, you need to really consider your gut. If you have obviously any digestive disorders, if there's current or historical use of medications, particularly antibiotics, antacids, laxatives, anti-inflammatories, alter medications, then you probably need to consider your gut. Maybe use some probiotics, maybe use some digestive enzymes from that perspective. If you have a history of gastrointestinal infections, that can might still be lingering, I suppose, in terms of its effect on your gut function. And obviously, a poor diet will affect our gut. Excess alcohol consumption, nicotine, and drugs can affect our gut and ability and affect its ability to do its work. And high stress. So, how do you optimize digestive function? Eat a healthy diet, reduce stress, develop good eating habits, eat fermented foods. They're very good for our bacteria. Avoid food intolerances. Take only essential medications. Minimize alcohol and other drugs. Take gut healing nutrients, which I won't go through today, but there's plenty out there. Probiotics. Try digestive enzymes. And treat parasitic and bacterial infections. So, this is a whole other lecture or webinar that could basically be talked about the gut function, but these are something that you do need to consider in terms of improving gut function. The other thing I just want you to consider, and I'll just put these up, is that all these medications can affect your gut. Now, yes, you can't see it actually, it's just but that first one that I've highlighted there, I'll just go through that. Those medications can affect depression, so they can contribute to depression. And surprisingly, actually, antidepressants is one of those. So if you're taking any of these, they can affect your depression. This second lot, they can contribute to anxiety. So if you're taking any of those, think about maybe, are they causing me anxiety? And finally, the previous lot was more around bipolar disorder, manic episodes and so forth, and this last one is the anxiety. So consider these medications. If you're on any of these medications, maybe have a chat to your doctor and look at how you can reduce some of those or substitute some of those because they could be impacting on your mood. So the way that I want you to think about this is my last slide here is really then if you include an integrative approach, an integrative approach includes the psychological, all the things that I've talked about today, your mood starts improving. There's no one solution. Each little bit gradually improves our mood, regulates our hormones, our neurotransmitters in our brain, and then we start feeling better. There will never, ever be one solution to improve someone's mental health. It's a multifaceted approach, and you need to look at which areas that specifically might be impacting on you, because what might be important for one person may not be for another, and then ultimately, as you target and results in and create small changes in several of these areas, your mood eventually improves. Thank you.
Thank you so much, Dr. Lopresti. Really appreciated all of that information. Gosh, there's so many different factors to consider, aren't there? We have a lot of different folks that have posted questions in our questions section, all kinds of different questions. So if you have a little bit of time, let's get started on them. All right. One of them is, do non-psychotropic cannabinoids help with mental health and anxiety and depression if you are bipolar?
I suppose it could do. I think there needs to be more research in that area at the moment. It's not my area for expertise at the moment, so I'm kind of cautious to comment on that. But I think it has potential. But I think we really need to look at it in more detail before it's recommended as a first-line treatment, that's for sure. So.
All right. Do you have any concerns that nuts and seeds, that some people would have problems with that damaging the digestive tract? Do you ever run into that?
Yeah, absolutely. I think for some people it can be an issue, and that's why we do really need to individualise it. I've had people come in where too much salicylates is a problem too, and salicylates are derived from your healthy foods, your herbs, your vegetables and things like that. So we do need to individualise it. For some people, nuts and seeds absolutely powerful and effective for them. For others, it causes significant harm. So I think somebody needs to really consider it from their own personal circumstances.
Oh, excellent. Here's another person who has a question about folic acid. Do you have any concern that folic acid in a B vitamin complex might actually increase anxiety?
Yeah, I think as I've included in my core supplements is the is your B complex, and as a general rule, I've included them because they're probably effective for the majority of people. But yeah, certainly for some people, folic acid can be a problem. I think as a general rule, it's probably fine for most people. And sometimes if people, I've had people, I had recommended a B complex, and it just hasn't worked well for them. So we'll remove that as part of their treatment plan. There are you can individualise it, personalise the treatments more so by doing tests and doing genetic testing and doing more comprehensive nutritional testing, which I haven't talked about today. But I think really people just got to look at their own symptoms and go, yeah, I took that, it made me feel better or it made me feel worse, and they just modify it accordingly.
Okay. If someone has breast cancer, do you have any concerns about rhodiola? Is rhodiola phytoestrogenic or contraindicated in people who have breast cancer?
I don't know much about that. Certainly if somebody came in with a history of breast cancer, I would very much individualise the treatment and be more cautious around that. So I suspect, that there's probably some reasoning for that, but I'm not sure. So I'd be working with somebody who's more knowledgeable in that area if somebody was coming in with breast cancer. And I suppose that's the key with the integrative approach, is that you also may work with, rather than just having one practitioner, you may need to look at having a range of different individuals, professionals who might be working and hopefully collectively, collaboratively working together. So.
Excellent. Here's a person who's asking a question that may not be something you're familiar with. They're asking a question about an echinacea product that was developed by the Hungarian Academy of Sciences in Budapest. It's a single echinacoside from echinacea that triggers the endocannabinoid system in the brain. It triggers cannabinoid receptors, and it's been shown to be effective for anxiety. In fact, there's a couple of human published trials. And this person is wondering if you have any familiarity with that specific compound that's found in echinacea that's extracted and then used as this natural medicine, or is that something you're not familiar with?
No, I recently saw a couple of papers, and it must be those papers that looked reviewed that did the study on the echinacea there for anxiety. So, but it's not available for. I certainly had a look at it, and it's not available for us in Australia. So. So I haven't used it personally, so I really can't make much comment on it. But certainly the studies look very promising.
Excellent. I know that it's not, I know it's confusing for people because echinacea is used for immune support, and I know that I've read those studies as well, that this is not just echinacea. This is one single compound extracted from echinacea. So it's not, so I just didn't want to give anybody the idea that start dosing up with cold and flu products and they're suddenly going to have their anxiety relieved. All right, here's another question. Wanting to know this, since you talked about so many different things, so many different supplements that can be custom tailored to individual plants, is there anything that you find that you use very commonly? Like, is there something that you use in almost all of your patients? Is there something that's one of the basic foundation ingredients that you find yourself going back to?
I mean, with the, at the moment now, from a depression point of view, the first ones that I will target now, use now, is your curcumin or your saffron. Particularly, there's inflammation or poor lifestyle habits, I think, going on. So that's probably the ones that I'll use from a depression point of view. From the anxiety point of view, the one that I probably move towards first is probably your theanine. But if people are also experiencing more your burnouts, lethargy, then I would move more towards your rhodiola or your ashwagandha, or a combination of the two. So. And for sleep, it's the magnesium.
Magnesium? Do you have a specific form of magnesium that you recommend for people that are having sleep difficulties? Because you did mention that the oxide form can cause problems.
I mean, I personally am also, for the availability here in Australia, but I like because of that glycine, research around the glycine, I like using your magnesium glycinate type forms, and they're the ones that I would move towards first.
Excellent, excellent. Well, I don't see any more questions in our Q&A box, so I want to take this opportunity to thank you so much for taking time out of your busy schedule to share this information with us about natural interventions and lifestyle changes that can make a real difference in both depression and anxiety. So thank you again, Dr. Lopresti.
No problem at all.
Folks, if you are interested in natural medicine, we do have a couple of upcoming events that you might be interested in on the Terry Talks Nutrition webinar series. The first is going to be pretty soon. It's May 18th. at 2 p.m. Central Time by K.P. Khalsa about Ayurvedic medicine, using Ayurvedic approaches to help individuals with autoimmune diseases. So again, May 18th, 2 p.m. Central Time. And in June, Solutions for Stubborn Viruses, Shingles, Herpes, Cold Sores, and Warts. Very romantic title, and that's presented by myself, Cheryl Myers. So I hope that you'll be interested and can tune in for that. That will be at 10 a.m. Central Standard Time. If you would like to listen to a recording of this webinar, or if you would like to listen to past recordings of webinars, you can find them on the Terry Talks Nutrition website, along with places where you can ask your own specific healthcare questions and read articles about natural health. There is also a YouTube channel devoted to Terry Talks Nutrition, youtube.com/ all one word, Terry Talks Nutrition. And you can find any of our webinars there if you would like to listen again, or if you have friends that you think might benefit from listening to this information. You can also follow Terry on Twitter, and we would be honored if you'd find us on Facebook at facebook.com/ Terry Talks Nutrition. If you would like to be notified of upcoming news and learn more about natural medicine, feel free to sign up for a free weekly newsletter at the Terry Talks Nutrition website. We are very scrupulous about your email information and never share it or sell it with others. And it's a good way to get information delivered to your email box every week to learn more about natural medicine and also about inspirational thoughts. So thank you, everyone, for joining us today. I hope you'll join us again for another Terry Talks Nutrition educational webinar. And until that time, good health to you. Bye-bye.